notice your wrinkles and large under eye bags. Okay, getting ready to go in. St. Anthony's Hospital, surgery number 3, surgery number 2 here. And it still doesn't feel like it's gonna happen, but it probably will. And yeah, what's next?
One foot in front of another.
I'm looking forward to the anti-anxiety push that the anesthesiologist.
What is that?
It made me all loopy, remember? When I got all loopy. And then I forgot everything. Well, I kind of liked it, but then I didn't like it. So we'll see.
You were all smiles.
I was. Goofy smiles. Okay. Alright, here we go.
Yeah, over there. So I usually park in the other parking lot. That's what looked weird about it. It's just warm out.
Yesterday was so nice walking around. It wasn't even that cold. I probably wouldn't want to go anywhere else.
It is pretty nice. And their landscaping is really beautiful out back. We should go walk down there.
It's really high class.
That's right.
Alright, so I have some wipes here. So you get to wipe your whole body down for this procedure. You are also going to take all your clothing off for this procedure and put the gown on, opening in the back.
Okay.
So I have 6 wipes here. So 1 for each arm, 1 for each leg, 1 for chest, abdomen, 1 for back. Okay. That's where the 6 go.
Okay.
And you can leave your hat on if you want until right before. If you're more comfortable with your hat on,
It's a little chilly this morning.
It is, yeah. And then you can take it off right before.
Okay.
And I'll bring back a warm blanket when I come. I don't have a blanket on the bed, and I'll bring you a warm one. If you shaved your legs last night or this morning?
No.
No? Okay. Then
I
you're
waited
good
the
to-
whole, like,
Perfect.
It's
So
been a
then-
couple days, so.
Okay, otherwise it kind of itches, so I'd have you shave your legs. So you're good. Yeah, gown open to the back, and then there's
Open to
socks
the
there
back,
for you
socks.
to put on.
Okay.
And a bag you can place your belongings in.
Okay.
Okay?
Thank you.
Just open the curtain, and I'll be back with the warm blanket, okay?
Here we go again.
Good time somewhere.
Well, I'm not as nervous as last time.
You know? Oh well, yeah.
Mastectomy was like crazy.
That was a big deal.
shaken up, and I was like I was really ready to run. Remember, you were like, I'll pull that IV out of you right now.
Yeah. I was actually willing to do that.
I know. I know.
You have to take a little bath with those things?
Yeah, but it's really warm. Look at that.
Oh, they heat them up or something?
One for each leg. Sexy, right? Where am I supposed to put it? In the trash.
Throw it on the ground.
Just.
Get all clean.
It's really nice, actually.
Really? Maybe you'll start bathing with those.
I
Yeah, I guess. I think so.
Right now?
Mm.
Yeah. Take my bra now too.
Hippo. So these are for hippos?
The hippo cleanse. Here we go.
Probably shouldn't videotape it, should I?
Think you can do my back?
Well, see why not.
I have an extra. What did I miss?
I think so.
So they're both in fact you exercises. One's in 2 and one's in 3.
You to keep those little socks. Those are the kind you wear to the jumpy.
Oh yeah.
Yeah.
They allow these hospital socks.
I don't think they could stop you. I think you'd just have to have traction on the bottom. Hmm?
Yes.
I think you can put them on either way or something.
I wasn't expecting that.
Those are nice.
Sexy, right?
Mm-hmm.
A little off the shoulder.
Mm-hmm.
Now it's cold. Now it's cold.
And then this one just monitors the oxygen level, so maybe we could put this over here because they'll use the blood pressure cuff, and if we don't put them on separate arms every time they pump up the blood pressure cuff, then it won't reach your oxygen. So that's why I picked 2 different hands. Sorry if I just squeezed your face. Okay.
This is nothing compared to what's gonna happen.
Oh yeah, that's true.
Love that, yeah.
It smells good.
Yeah, it's kind of refreshing, I think, you know?
You should try this for your nose.
I know, I should.
And then there's the red one.
So you think chemo did that?
It makes them fragile.
Yeah, it does affect the veins.
They rebuild?
Yeah, they're usually, not usually.
Oh, really?
I don't think so. I think they're kind of,
You'd think they would be able to.
yeah, maybe.
I haven't really done much research on
Yeah.
that, on how veins rebuild or not.
That's the hot pad to get them to come out?
Yeah.
Yeah, it kind of just brings them up. When we're cold, our veins constrict.
Yeah.
They hide.
They hide, yeah. That's a good way to put it.
It's toasty. So they've got the air flown in.
You like it? Is it really warm?
Right?
Is it warm?
Just mild.
Uh-huh. You probably turn it up too. Nice.
So my surgery has been delayed 1.5 hours. So Dr. Wilcox had some complications with another patient, and so now I'm not going in until 2:30 to 6. So I got some time to kill.
Let me go get you some coffee.
Do you ever? I wonder if people worry. Like I worry, like my surgeon's gonna be tired.
I'm sure that's common to think that.
Like, oh, he's gonna be exhausted by the time he gets to me, or is he gonna be that? Or is he gonna be nice and warmed up?
I think he's going to be nice and warmed up. He'll have a little break between hand. I would think I would want him warmed up. Yeah. I think you're better now. In better position.
excited to get this thing out.
I'm sure.
It's actually not too bad. I almost don't really notice it. It's become just a part of me. So.
Yeah, we hear that. Everybody's usually feeling better when they're out.
Let me just pull this up. I was just looking at it.
Okay.
Okay.
What happened?
Okay, so my surgeon's ready. He did some drawings on me, and he's gonna do some.
What are you gonna do with your
here.
neck right there? Oh, it's just like the center point.
Oh yeah, maybe.
Oh, that's so crazy.
Now that I'll do a little. So he's gonna actually do an anchor, not the lollipop incision. He's gonna be doing the anchor, and he's gonna have to kind of move it up this way and do an incision under here too, because that's the only way to get it to match. So I've got some drawings on me and some drawings on me.
Wow.
Bye bye.
It's amazing. Let me see outside. Because that's where he's going to take it from?
Mm-hmm.
Wow.
He's gonna get it from the flanks, and then if he needs more, he'll get it from my tummy. So I guess they're gonna come get me now. Nervous.
What drug are they giving you? I'm so
Lots of
proud.
drugs.
No, but what's the one that makes everybody smile?
Oh,
I'm going to play that song when I see you smile.
dang it, I can't remember.
Fentanyl? No, that's a bad drug. That's a really bad something. I don't know.
I can't remember. But I won't remember, basically. So, okay, boo.
Okay.
Can't wait to see you when I wake up.
I'll be right there.
Okay.
Okay, deal.
Yeah. Okay. Any glasses or contacts? Nope. Oh, I do have glasses. Okay. Anything with you? Okay. Any hearing aids, hearing devices? Nope. Any dental work that comes out of your mouth? Really? Okay. Any jewelry on? Piercings in? Okay. Any metal implants in your body as far as metal joints, pacemakers, nerve stimulators, anything like that? Anything like that. All right. Any questions for me, I think? No. Okay. Do drawings. I like to draw all day long.
Yes.
Come and do drawings with me.
Yes. Bum looker.
The
bum looker.
Cheeky monkey.
Yes, I have that. I have that. This whole set of Saturday Night Live, and that's on it.
Yeah.
That recently said. It gives me goosebumps. My buddies and I used to watch that like
I love it.
over and over again. So she's been medicated.
Yeah.
You ready?
A stiff cocktail.
Yeah, I think it's kicking in right now.
Already?
Yes.
All right, so hugs and kisses. See you later.
I want to put my head back a little bit.
Yeah.
Relax. Yeah.
Or high fives or whatever.
Hugs, kisses, high fives.
Let's take another kiss for everyone.
Okay.
That'd be nice.
Yeah.
All right, we'll take great care of her.
All right.
And then Dr. Wilcox will come out and see you in the waiting room.
Okay.
Okay.
Yep. Couple hours, right?
Yeah, you have a little
Okay.
bit of time. Yep. Sounds good. Thanks.
Take good care of her.
Okay. I guess.
Okay, thanks.
I'm not sure. We have a Molly and Melody.
Yeah.
I'm Michelle here in this
Okay,
department. In this
okay.
department.
Yeah,
but
yeah.
I'm not sure. She came over to me. Oh.
Uh-huh.
Let's see what time is it? Like 45 minutes ago. She's been pretty sleepy.
Okay.
Michelle.
There she is. There she is.
Were you able to get the prescriptions filled?
Yes, I was. Should I have them with me? They're in the Jeep.
No.
Okay.
It's only.
Oh,
Snoozing.
how are you doing there?
Some pain.
You have some pain?
And some pain creeping up. Okay.
They gave me a pain pill.
You need some water?
Your pain level now.
It just kind of feels like it's a burning, sharp
Woozy? Sick?
Oh, Lucy's sick.
Just like really tired, just a little bit nauseous and just kind of dizzy.
We did a few Mrs. Fox because I'm seeing that we have none. Well, yes.
How'd you do in math? Really?
Looks
Right now? I think we probably did really good. Haven't heard any updates.
how long time ago? I think they said fine.
What's up?
I think they said it went fine. But just yeah.
Just in case worse comes to worse.
Oh, yeah, right. Poor girl. Just out of it, huh?
I think it feels like a hangover.
I bet.
Oh, it feels really good.
Huh?
That feels really good.
Do you remember anything? No, of course not.
I remember getting all the way wheeled in this time.
You do?
Yeah, Laura's here.
The lights in the room
Uh-huh. And then
and
after that,
breathing the
another.
mask.
Well, you got through that little number. Last surgery. Last surgery. Congrats, Boo.
Thank you.
Congrats.
And then we have reading material that we're gonna go over that you have to refer back to
Okay.
on breast augmentation and care afterwards. Fall prevention at home simply because of the medication that you've had on board. You have a post-op appointment tomorrow, January 28th at 11:30. Okay, that'll be with Michelle, the nurse practitioner.
Okay, is that here in the card?
It is, yeah. Right across the sky bridge. Their phone number is right here on this first page in case you need them for any reason. You have your appointment at 11:30 tomorrow, but thereafter for reasons that we'll discuss. Okay. Dr. Wilcox wants you to ambulate progressively. That means you get back into your activity slowly but surely. Okay, tonight you're going to be sleeping. Tomorrow is going to be a pretty relaxing day as well. Taking care of yourself. Getting up and walking about to the kitchen, to the bathroom, maybe just that's about it. Okay. And then each day you'll just kind of progressively ambulate or walk a little bit more. If you have any shortness of breath or chest pain, you're going to call 911. It's always the case, but certainly after a procedure, all the more reason to not ignore those kind of things and get in right away. Dr. Wilcox would want to know if you're running a fever, got a temperature going, severe uncontrolled pain. We're going to talk about pain med and pain management, and if you have severe uncontrolled pain as you're using these things that he's provided, then something could be up and could be an infection or something else, but definitely would want to know. If you're not able to keep fluids down, so you get home and you're using your pain meds and nausea is creating an inability to stay on top of your pain, or you're not able to keep fluids down, you call right away. You're going to watch your incision sites on a regular basis for signs and symptoms of infection. So redness, swelling, oozing, any kind of foul smell, yellow or green discharge certainly would not be right. So that would be a reason to call. If you have any adverse reaction, to the oxycodone. Visual changes, hives, persistent dizziness, extreme fatigue, give him a holler. And then for the next 24 hours, because of anesthesia, working through your system, don't want you to drink alcohol, no smoking, don't drive, don't make important legal decisions, care for small children, or operate machinery. You can resume your usual diet, just take it nice and slow, okay? We advise clear liquids and real bland food. Nothing too hard to digest. And then increase your fluid intake to rehydrate. Dr. Wilcox talks about elevating the head of your bed about 30 degrees. So some pillows at home, okay? And then an incentive spirometer, I'll grab that and we'll go over instructions of use. It helps exercise the lungs.
That's the one
You inhale.
you suck it in.
Yeah, exactly.
I remember
Yeah. It has a little blue disc that you want to have. Yeah. Yeah. So he wants you to use that every hour while you're awake and every 2 hours at night as needed. That's if you're running just a slight temperature, you kind of blow off anesthesia, keep your lungs clear and healthy. Stand and walk day of surgery. You've gotten out quite late, so tomorrow that'll be your day. All right, we got some repeated information, and then
Anything about like compression garments or the like the how to manage or what am I supposed to do about the lipo area?
oh,
Like keep those on like, pretty much 24/7 for 3 weeks besides laundering and showering, right? I was doing a little research on that, like not keeping the off for more than like 30 minutes.
what are we talking about here?
I had the liposuction
Uh-huh.
for the fat grafting.
Mm-hmm.
So like any instructions on compression garments?
Okay. Let's see. I don't know that he has specifically written that out.
Okay.
So we'll probably get to that because he has a section with greater instructions. If it's not in there, that would be definitely a question to put down tomorrow for your appointment. Okay, get specifics from the nurse practitioner. So we're on medication at the very moment, and you did get, like we said, at 6:45, 1 tablet of oxycodone, okay? You can take 1 to 2 every 6 hours as needed for pain. So, next. So because you only got 1 tablet, and we're trying to transition into the way it's written for home use, and I don't want you to get your pain 10 out of 10 waiting the whole 6 hours. So either 9:30. I'd say around 9:30, 10 o'clock. Go ahead and
Take the second one.
yeah. Well, or start on your
It's another dose.
start on your 1 to 2, and then keep it every 6 hours.
Okay.
Okay, if you're paying at 10 o'clock, you're about to go into bed, you got in and out of the car, you're finding it up there. Take 2, you're about to go to bed, set your alarm for 6 hours. You want to assess your pain in the middle of the night. The first
It should
probably
help you
2
sleep
nights.
too, right?
Yeah, it does tend to make people pretty sleepy.
Okay.
Excuse me just one moment. So opioid pain medication information. All right, lots of reading material here. We're going to go over a few things together. I'll highlight them with you, and when you're more awake tomorrow, if you have some particular questions, it's probably answered all in this paperwork. All the do-nots while you're on the oxycodone, very similar to that of the anesthesia. Okay, it is illegal to drive while you're on the oxycodone. And then in addition, don't take any sleeping pills. Your melatonin is fine, however. Okay, you won't be participating in these activities anyway. It talks about some rock climbing and water stuff, so no worries there, right?
You're sure gonna cancel the rock climbing?
Yeah.
mountain biking tomorrow.
Opioids can cause side effects, constipation being very common.
Yes, it always gets me. Oh, you know, I have a stool softener. I'm remembering in my bathroom, in my right hand drawer in there, I do have a stool from when I was on chemo.
Yeah, so grabbing that and being preventative instead of waiting till you're like kind of
Yep.
having issues. That choosing good foods, you know, fiber, drinking lots of water and walking when you're feeling, you know. So yeah, that's working out for you. Nausea, vomiting, again, you're going to call if you have issue with that. Drowsiness and confusion. Get kind of familiar with what one oxycodone feels like versus two.
Understand God. Oh, Holy One, we ask your blessing tonight on all of our patients and their families, and on all of our staff and our families. May we have protection, comfort, and peace. May this hospital be a place of healing and hope tonight. Amen. And now, in keeping with our
So
efforts
care
to promote an
afterwards?
optimal healing environment at night for our
Bruising,
patients,
soreness,
we reduce noise
some
levels
swelling in your breast.
and limit
This may
tests,
occur and
treatments,
last for a
and
few
visits.
days after surgery.
We ask that you conclude your visit by 9 p.m.
Breast
to
pain,
allow our patients
not uncommon,
time to
obviously.
rest
That's
and
why you
heal.
got some pain
Thank you
medication.
for trusting us with your care, and good night.
It's all cleared out.
Oh boy, it's pouring out there.
There you go. Abu.